a day getting to chat with you, and I was sharing a little bit about you before we got to join together about just the awesome work that you do as a physical therapist and how you're also a movement instructor, and you have a lot of incredible passions in the work that you do. So Kayla, I would love for you to just share a little bit more fully about yourself and, you know, what lights you up and really like what drives you in doing the amazing work that you do in your private practice.
Absolutely. So I'm Dr. Kayla Borchers. I started my private practice this August. So prior to that, I was a physical therapist at a large sports medicine clinic here in Columbus and worked with professional athletes, Division I athletes, and then our weekend warriors, right? Our parents who wanted to stay active. And I kept finding that I would have women come in to see me 10, 15 years postpartum. I did running gait analyses and would have a lot of women who were having deep hip pain or back pain consistently with running. And when I would really evaluate them, we would find their rib cage angle was flared and they had a lingering diastasis that had been present since giving childbirth. And whenever we trace things back, their symptoms often began after having kids. But they ignored it because they were busy with life and didn't seek help until later on. So my passion after becoming pregnant with my daughter 4 years ago, so I have a 3-year-old daughter and then a 1-year-old son, my passion really dived into the postpartum world when I was pregnant with my daughter. So I took a prenatal and postpartum corrective exercise specialist course and have just continued to work with that population to help women stay active during pregnancy and then beyond, and to just make it as seamless as possible because I get it. I'm living that life right now. I have 2 little kids and I understand how challenging it can be to find time for yourself. So finding a way, you know, that we can incorporate exercises into your daily routine is a big passion of mine. And that's part of why I started my private practice. So I now work out of a local yoga studio in Grandview, seeing clients in person. I do orthopedics and then prenatal and postpartum care. And then I also have a virtual component to my practice where we'll do, you know, wellness consults virtually.
I love it. And Kayla, I'm sure there will be many people who will hear, you know, what you're going to share with us tonight and will want more. Obviously, they'll see your handle. They can click on your handle, go through your bio. But will you share like a website too? Will you just say like what your website is so that if anyone's watching this, they can like type it in and check it out?
Yes, drkaylaborchers.com. So everything's under my name, Dr. Kayla Borchers.
Amazing. Thank you so much. One thing that we talk a lot about in Unmeasured is this idea of feeling safe and supported as we move our bodies. And I just believe so deeply that the work that you are doing with your clients is so at like the core of that, is so foundational to that. What does it mean to feel safe and supported as we move our bodies? Sometimes that means that we need to find like the space to heal, or sometimes it means really, you know, focusing on movement that might not be the quote unquote like glamorous movement that we think about when we think about having like a movement practice or moving our bodies. Sometimes it's doing things like the, you know, physical therapy movements and like practicing those exercises. And I feel like more conversations about how this can positively impact our overall health, how we feel in our bodies, how we're able to show up in our lives, helps people to understand like, okay, this is really important. And if something maybe doesn't feel quite right in my body, or something feels off, or I'm having pain or I'm having discomfort, like this is the kind of person that I can go to and I can talk to, and who wants to help me and who wants to help me to feel safe and supported in my body so that I can move off and on my mat.
Absolutely. And I want to reduce the fear around it, right? Like you hear the term diastasis recti, which is a quote abdominal separation, right? So it's an increased space along your linea alba where those 6-pack or rectus abdominis muscles are. And so what you see clinically for that is a doming or like a bulging out right in the middle of the abdomen there. And so by the end of pregnancy, nearly 100% of women have a diastasis. Now, 80% have it after giving birth, right away. And then that number goes down as we get out in the timeline. But at a year postpartum, over 30% of women still have a diastasis that's unresolved. And there's so much we can do between birth and a year out, right? You don't have to wait that long to see if it's impacting you. So the core system is all about pressure management. And so a lot of this involves breath work. So learning how to manage your pressure system. As your diaphragm goes down, your pelvic floor should go down. As your diaphragm goes up on the exhale, your pelvic floor should come up. And then looking around the core cylinder, as the abdomen goes out, your side rib cage and back muscles should also go out. That should be like a balloon expanding in all directions. Sometimes people think of diaphragmatic breathing as just belly breathing. And so if you think of that in terms of the linea alba, if you just belly breathe, you're putting increased stress and tension from the inside out in that area that we're trying to let heal. So a lot of this is one-on-one work to figure out your breathing pattern and then use that functionally. So I like to make physical therapy not boring. Like, how can we incorporate this into your movement patterns that you're already doing? Something I say a lot is blow before you go. So if you're getting your baby out of the crib, or if you're picking something up from the floor, exhaling before you pick up that load, which helps recruit your pelvic floor and your abdominal muscles, so we can help close that gap under load.
That's such an amazing, like, very practical thing, like, to think about and to have people remember really quickly, Kayla, because you said something, and I feel like I can imagine that some people in their mind maybe are asking like this question. You mentioned like we don't have to wait until a year postpartum to support with stuff like this. But what if someone's like, wow, I'm like 7 years out, or I'm 9 years out, or I'm 2 years out, or whatever it might be. Is that still something that someone could be working on at that moment in time?
Absolutely. Awesome. So like I said at the beginning, I mean, I've worked with women who are 10 or 15 years postpartum. Once postpartum, always postpartum. I mean, our body goes through a huge change. And it should be noted too, you don't have to have had a child to have a diastasis. I've had men who have an abdominal separation, and they come in with low back pain, and we're looking at all the things. They've been to multiple physical therapists and haven't gotten better. And I'm like, you've got a diastasis. Like, we need to address your pressure management here at your core. Like, so this can be men, women, postpartum, not postpartum, across the board. But yes, we can see responsiveness and change years and years down the road.
Thank you so much for clarifying that. I feel like that's such a hopeful thing for people listening to hear. Like, it does not matter how long it has been, like, or how this happened. Like, these practices can be supportive.
Absolutely.
I love that. So blow before you go. I'm going to remember that. I feel like I'm going to start implementing that into like my daily practices.
Yes. So I love that one. And then the other thing I want to mention is to not be afraid of loading. So, think about what activities you're wanting to get back to. So a CrossFit athlete, we're going to look at really high loads, right? Like, what movements are they wanting to get back to? They may look great on the mat or on the table. But then when we pull them into movement patterns that they're doing as part of their workouts, we may see that doming and some symptoms come on from a diastasis. Same thing goes for yoga, Pilates, whatever your movement pattern is, let's look at you for that. So one of my favorite screening tools is, yes, we look on the mat and it's just kind of a head crunch, and we see, is there a doming there down that central line? And then looking at it more functionally, I love to look at a single leg squat. So, all of us do stairs. A lot of us run. Even if you're not a runner, you're chasing after your kid, you're running across the street. So how is your trunk and your pelvic stability during a single leg activity like that can tell me a lot about your pressure management and your core coordination.
That's awesome.
Yeah. And then beyond the breath work, it's about continuing to progress those loads. So I had a pregnant mom the other day who was like, I was told not to work my core during pregnancy. That is so not true. Like, you can do so much for yourself during pregnancy to help those muscles and that fascia be more responsive, which is going to help you in the healing process later down the road. So you can do planks during pregnancy. You can do side planks during pregnancy. You can do core moves. However, you need to look at your own body and what your symptoms are. And that is understanding how to manage your pressure. So I highly recommend having an evaluation with a physical therapist or a movement professional who is skilled in this area to look at you one-on-one and to educate you on how you can manage your own pressure system. So, some women can do a full plank, right away or all through pregnancy. Some women have to drop to their knees, so it's finding what works for you. And you do an awesome job, Simi, in Unmeasured, giving tons of different modifications for exercise. And so I just want to encourage anyone watching, take those modifications if you need it. Know what works best for your body and let go of that ego of, oh, the person next to me is doing this if you're in a group class, because they may be at a different phase of their healing journey than you are.
Totally. And I also think it's so important to remember, we never know how something feels in someone else's body. Yeah. Someone could be doing something that doesn't feel great for them. So we never know what someone else's story is or what part of their phase that they're in. And also at the end of the day, we are moving to celebrate our own bodies and moving to celebrate ourselves. And so when we make the choices that feel most supportive to that, that's I feel like that's such an act of celebration, to pick the option, to pick the modification, the alternative that feels most supportive. It's celebrating movement in your body in that moment, in that phase, in that day. So I love that.
And it's so important to know all the other factors that go into this, One day you may not have slept well the night before, especially if you have a little one, right? And so your tissues are not going to have been as recovered because they didn't have sleep to repair. So that all factors into it. So you yourself could feel different from day to day or week to week. And that's okay, giving yourself that grace when you need it. But also not being afraid to load and apply that stress to the area to allow that adaptation and that change, pulling away that fear of, oh, am I going to hurt myself if I do this? Just cautiously load, cautiously progress into it, but also trusting yourself and your body that if it feels good for you, you can gain that strength and you can continue to progress and move into those greater loads.
It's so empowering when you understand what actually is happening in your body and you have that information and you have that knowledge, because then you don't have to feel afraid.
Right. Absolutely.
Totally. This is so awesome, Kayla. I really appreciate it. I literally am going to think Blow Before You Go nonstop in my mind as I move through my day.
Yeah, I love it, because with that, when we recruit the pelvic floor first, kind of that bottoms up approach, when you recruit the pelvic floor 30%, then we can get the abs engaged for that greater loading beyond that. So you kind of start there and then we get to recruit the core and you just manage that whole pressure system together so that we avoid things like leakage, prolapse, diastasis, because that all involves that whole core pelvic floor system.
After the last Instagram live that I did with my friend Alyssa about pelvic floor health, I got so many messages from women sharing about abdominal separation, and they were this would be so helpful. Can we have more of this conversation? So I just know that there are so many people in this community who are going to hear this and feel number one, they understand a little bit more about what's going on. And number two, oh, okay, I have these things that I can start to practice, and I have a little bit more understanding.
Yes. So I hope that this can be a starting point and get that conversation started, get your own thought process started. And please, if anyone has questions, reach out. I am an open book. I'm happy to chat through these things, happy to work virtually or in person. I'm so passionate about this. So
thank you so much.
Yes, you're so welcome. Thanks for having me, Simi. This was so fun.
Of course. I love it. I'll chat with you anytime.
Perfect.
Thanks, Kayla.
Yeah, have a great day, everyone.
Bye. So, I hope you're all having a wonderful evening. Simi here, and I'm so excited to be back for another Instagram Live. This is such a